Hi, my name is Angelina Chardella, and this is my Psychology of Aging final project. The three topics that we will be talking about in this workshop are ageism, mental health in older adults, and support for caregivers. I chose these topics based on my two interviews. My first interview was with a family friend, Miss Henschel, and she shared her experiences with me of her taking care of her grandmother. Her grandmother is in her mid-80s, I believe, and has been unofficially diagnosed with deliria, which means that she experiences hallucinations, mood swings, kind of in and out of reality. So Miss Henschel was very kind, and I was fortunate that she sat down with me and told me about these experiences. She also told me about what she wishes that she did and ways that she felt she could have been more supported and could have bettered her well-being. My second interview was with my grandma. Her name is Kathleen Totterdale, and she just recently retired. So she has been and has found a job in the new job market, and she shared with me what that experience was like for her and how difficult and not difficult it was. And I think that my workshop will impact aging adults, caregivers, and families with elders in them. This workshop will help you learn more about aging and how it will affect you, as well how it will affect everybody around you. You will also learn how to benefit the well-being of caregivers who work with older adults. So that is also very important, and this can benefit families with elders because it can help you create a better rapport and better communication and hopefully better relationships with the elders in your family. So our first topic is ageism, and ageism is a prejudice about a person due to their age, and this is typically experienced by older adults. Some of these negative stereotypes that you'll see are that elderly people are mentally incompetent, they're weak, or they're physically frail, or they can't work, or they're unable to work efficiently. And we know that these are stereotypes that are not necessarily true. There's a study done by Marquez in 2020 that focused on the different determinants of ageism that's pointed towards older adults. And two of these I would like to highlight today are intrapersonal level determinants and interpersonal or intergroup determinants. Intrapersonal level determinants are focused more on the anxiety of aging and the fear of death and somebody having this anxiety of getting older. The second thing, however, and it is the most important, is interpersonal or intergroup levels. And this is because this focuses on the quality of contact over frequency. This is more focused on trying to create a positive image of older individuals because it is harder to create negative stereotypes or believe these negative stereotypes when you have these positive images of older people. Ageism also affects individuals physically and mentally and even economically. Some of these effects are that older people are at greater risk of engaging in unhealthy behaviors, and this includes drinking, having a poor diet, drug use, smoking, and these can be used as coping mechanisms for how they're feeling. This can also affect them mentally. It can affect their confidence, their mental diagnoses, how depressed or anxious they can be. And this can even have an effect on society in a way that we never really thought about. The World Health Organization said that ageism can divide generations in a really significant way, and some examples can be contributions of young employees, and the influence of economy and how many skilled older workers are in or out of the workplace. So what can we do to combat ageism? There are a couple of things in this workshop that I wanted to highlight. The first one being to further educate individuals about what discrimination can look like for older adults and how it can affect themselves, others, and how to change their attitudes to combat these ideals. One way to do this can be learning what microaggressions and typical stereotypes look like, and to teach other people, peers, family members, um, anybody else in their life, what these also look like and how to redirect these thoughts to looking at a person being them whole selves and not just from their age. The second one is consuming more media that portrays positive images of older people. Um, there is more, I would say, negative representation of older people in the media. A lot of this can be due to like cartoons, different TV shows, uh, commercials. There are just so many different ways that we are being advertised to and trying to say that older people are weak and they can't really do as much as younger people. But if we have these positive images, then we can combat these other ideals. And the third thing that we can do is communicate and spend time with older individuals, because as I previously said, the more you interact with something, the more that you tend to like something, the harder it is to develop those negative stereotypes. And that is pretty much all that we're trying to focus on. So these are 3 ways that we can practice to help combat ageism. Our second topic is mental health in older adults. And I want to share the most common mental diagnoses amongst older individuals are depression and anxiety. And based on the World Health Organization, around 14.1% of adults that are age 70 or older have a mental disorder. Some of the risk factors, the main ones and the more important ones, are social isolation and loneliness, because about 25% of older people are affected by it. Another risk factor is abuse. It is very important to take this into consideration, and this can involve a variety of things. It can be physical, mental, financial, sexual, and even neglect. And these risk factors really heavily contribute to depression and anxiety. However, this workshop is going to show you how to improve your mental health. And one of those things can be joining clubs or hobbies to help limit or eliminate that isolation. So there are things such as knitting groups or bingo, reading, religious groups. There are so many different things that you can join that have been proved to improve your life satisfaction and quality of life based on the World Health Organization. The second one is encourage healthy lifestyle choices, such as getting more physically active and eating healthier. Another is creating programs that target the well-being of older individuals, and this could be ways such as safe transportation, accessible housing, financial help, all of the little things that kind of slip through the cracks that we don't necessarily think about until it kind of hits us in the face like a brick. And it's so nice to be able to have those resources, especially for older individuals that may not know what programs that we have, and just be able to share that. And the fourth one is to have support groups, have local support groups. They can have social skills training, volunteer opportunities, and it helps foster healthy communication. Our third topic is support for caregivers. I want to share with findings from the AARP, and that is the American Association of Retired Persons, that emotional stress that was reported from caregivers affects over 1/3 of family caregivers. So that's over 33%. And that's a lot, and that's something to be heavily considered and looked at. It's also shown that many studies have high rates of psychological distress among caregivers versus non-caregiving groups. And I also wanted to highlight that women especially show higher rates of stress and worrying. Women in general have higher tendencies, a lot of studies have shown, to take more on a caregiving role more than men typically do. And I also want to highlight that because women today are also working full-time jobs, and they're taking on more than one responsibility other than being a parent, being an employee, having these hobbies, anything else that they do, adding on caregiving is a lot. We can support caregivers by encouraging self-care, and this is listening to music based by the AARP 2023 survey. It was found that 70% of people like to listen to music, around 66% of people found it beneficial to talk to friends and family, and 52% found benefits in exercising. Another way to help is therapy and counseling, and this is more focused on the strength-based approach. And that is where you identify the individual's strengths and improve their well-being and growth based on that strength. This gives realistic expectations, help in communication, learning when to seek help, and setting goals. And the last one is to be aware of sources of support. As I said, it's important to look at local community resources to prevent feeling isolated or alone. And it's also important to look at family, because family is one of the biggest sources of support, and family dynamics can change. So it's important to practice those difficult conversations and have this communication. So, in conclusion, we have successfully covered the topics of ageism, mental health in older adults, and support for caregivers. And you've learned some knowledge that hopefully you can pass on along the way to either older adults that you know are in your family, or if you know any caregivers that you would like to send this information out to. I just think it's very important that people, and especially caregivers, know what resources that they have and what they can access. And all of these topics are highly relevant today, so it is very important that we learn more about them and try to better the well-being. Thank you.